Hi, thank you for joining us today for this week's department update. I am Cord Overton, the Communications Director for the Iowa Department of Corrections, and I am joined here for this update with several members of our department to help give you a little panel view around the department right now as we go through several outbreaks of COVID-19 around the correctional system. Joining me today will be the Director of the Department of Corrections, Director Skinner. I'll also be joined by Warden Weiss of the Clarinda Correctional Facility and Warden Larson of the Anamosa State Penitentiary. With that, I'd like to dive right into some questions that I prepared to ask each of the digital panelists with me here today. So I'd like to start with Director Skinner. Director, can you give us an update on the latest numbers from around the system as of right now, which is 11 a.m. Friday, November 13th?
Yes, and good morning, Cord, and thank you for facilitating this discussion. Thank you, Warden Weiss and Warden Larson, for being on this panel to discuss what's happening in each of your prisons. Again, it's really important that we get this information out to the public, family and friends of those and loved ones of those that are incarcerated. So thank you for your time today. I know everyone's very, very busy. First, I want to start with just telling you that the numbers in the aggregate in terms of what we're seeing across the state, our 9 institutions. Total positives we've seen since the outbreak in March, it's been 2,690 total cases. Currently, right now, as of today, we have 1,322 positive cases across all institutions. Also, want to let you know that 1,363 have recovered. And unfortunately, during this time, we have lost 5 individuals incarcerated that have passed away from COVID and other medical complications.
Okay, thanks, Director. And that number you gave, the current positives, do you expect that number to stay relatively close to that for a long period of time, or is that likely to change in the coming days?
It's likely to change probably in the coming days. And one other thing I wanted to share with you is I want to actually break down the positives by prison as well. We still do have many pending tests out there. Both wards, if I share that with you, but we have a lot of pending tests across the state. So that most likely will change. But I do want to give you a drill down in terms of what we're seeing in each of our prisons. So currently at Anamosa State Penitentiary, we have 679 positives. At Clarinda, we have 318 positives. At North Central Correctional Facility, we have 256 positives. Mount Pleasant Correctional Facility, we have 44 positives. The Women's Prison, we have 3. Fort Dodge Correctional Facility, we have 2. Newton, we have 1. IMCC, the Medical Classification Center, we have 18. And at the Iowa State Penitentiary, we have 0. Please note, too, as we do have pending tests, we will also be retesting next week. And so there'll be more tests on the horizon and continue to check these individuals that are testing negative. So we'll be continuing doing that into next week.
Okay, thanks, Director. We'll come back to you in just a little bit, and I'm going to jump over to Anamosa, to Warden Larson. Warden, could you give us an update on how things are going at ASP?
Yeah, no, thanks, Cord, and thanks, Director, and thanks, Steve. I'm glad we could all get together today because I couldn't agree more with the Director that the communication is key here, and we really want the correct information going out because it really is damaging and really causes pain for loved ones and everybody else out there when they don't know what's actually really going on inside here. So anyway, appreciate this opportunity. So currently today at Anamosa State Penitentiary, we are in the process of recovery process for the first round of testing that we had. So just a little background, October 29th is when we had our first positive results come back. We had a couple guys that had symptoms, we tested them and they came back. So at that time we went to restricted movement beginning that night, October 30th, then we went to restricted movement and then we did mass testing on Tuesday, the 3rd. When those results came back, that's when we had our large amount of an outbreak. As it's been probably seen in the news, we had about 484 positive at that point. So that being said, we separated all our positives and negatives guys at that time, and we've been monitoring them since then. And you know, anybody needing extra medical attention, they've been seen by our doctors, our medical staff. We have excellent medical and doctor staff here. And those that were struggling, we've sent to the hospital. But most guys are doing just fine, and we monitor them all the time. But I say all that with the director just shared some numbers. Most of those guys are going to be recovered by the end of today, most likely. They're being seen by our medical staff, and most of those guys from that initial testing on November 3rd will be recovered. So that's excellent news. Like I said, most of those guys are doing well. Most of them are asymptomatic. They just have to get cleared by the doctors. So that's going in progress today. We just did another round of testing for all the guys that were negative from November 3rd. We did that here last Tuesday on November 10th. We just got those results back last night, and we are working on that. So we had an additional 233 positives. So that's really where, at the end of today, we'll probably be right around that 230 to 240 range of positives here at Anamosa. So we are making progress. We are on restricted movement. With that means the guys are, and I'll touch more on this in a little bit, but the guys are on restricted movement. They are allowed to, they're coming out and they're getting showers and they're getting kiosks, and they're, we're serving their meals. We're doing laundry every day. So that's kind of where we're at right now. Today, again, this virus has really hit, obviously our incarcerated individuals and our staff. With the community being on such a surge and a high percentage in the community, we held this thing off for 8 months, but it finally did make it through our walls. But we are doing everything we can to make sure everybody stays safe and they stay healthy. So it's been a lot of work, a lot of long days, but we are going to get through this together.
Okay, thanks for that. Warden Larson, we'll come back to you in a little bit. I'd like to switch over to Warden Weiss down at Clarinda Correctional Facility, where the director actually is right now, checking in on things. But Warden Weiss, how are things down at Clarinda as of today?
Well, as Jeremy stated, I'd just like to thank everybody for taking the opportunity for us to share the information we can. And as Jeremy said, it's very important that we get the accurate information out that we can, so everybody understands what our processes are and how we're trying to limit and mitigate the spread of the virus. As everybody knows, this is a very challenging time for every correctional facility, and we are certainly one of those as we work towards trying to contain it and to make everybody safe, not only incarcerated individuals but staff, and trying to make everybody as safe as we possibly can with the circumstances we have around us and what's presented to us. Before I get into kind of where we're at, the staff has done a really great job here, and people have been patient with us because, as Jeremy stated, we have a lot of planning that goes on, and it's a very fluid situation for us, and we have to respond to challenges that are presented to us daily. As far as if we have somebody that's presumptive, somebody that's positive, somebody that's recovered. So we're very similar to what Jeremy explained a little bit about their institution, but we kind of approach it in the same direction. One advantage that Clarinda has had, this is not the first outbreak we've had. We had a very small outbreak back in April. Actually, we contained that to one incarcerated individual. We had another outbreak at the end of September, very small, about 60, I think it was 61 or 62 positives that we had. We contained it to a unit for the most part. And so we developed a plan early on of how we were going to try to lessen the containment or stop the containment and try to mitigate it. And what we do is if we have an incarcerated individual showing symptoms and it meets what we call our MAP, or our Master Action Plan, which has a criteria in there for the incarcerated individuals that we have to isolate. We isolate them immediately, which means we pull them out of the unit, we put them in an isolation unit. And what we do at Clarinda is once we do that, we normally isolate the cell that they were in. We put them on what we call a very hard quarantine, which means they're very restricted to their cell. We coordinate their movements, and then with the unit, we put them on a little bit more of a soft quarantine, where we contain them to the area. But maybe not, we don't lock them down in their cells as quickly, but then we start the monitoring process with temperatures, staff doing their assessments on them. So we do it very similar to there as the Anamosa did. We just kind of control the units and try to control the movement. As we start seeing spread, as we did this time, we started a lot quicker with controlling what we did with our units as far as movement and containing them to an area, trying to move them as a unit. As we got more presumptives, we started to, we placed them in our isolation unit. And then we initially started the test on this last third round. We started the test. It was a couple weeks ago. We had a couple incarcerated individuals that tested positive. And so then we got into kind of the same method that we used before. We started testing. So we tested that individual. We tested the units. Once we first got the initial unit tested, we understood that we probably had a lot more spread because of a larger number than what he experienced. And we just went on from that way. But I just want to reiterate to everybody out there, because this is very fluid, and we get challenges thrown at us every day with the virus that causes us to change our way we're handling it. If it's unit, if it's cell, if it's the institution, every incarcerated individual, we let them out of their cells for a period of time so they can use the kiosk machines to contact their families, so they have the ability to take showers. They have the ability just to get outside their cell for a little bit. We also we're able to, because of our setup and our infrastructure, get them some yard time. So most every incarcerated individual gets a little bit of yard time, even if they're on a positive unit or a quarantine unit or a recovery unit. We're getting them yard time. Last I just want to share is we're very similar to ASP. We just cleared yesterday, I think 82, so we're starting to do the recovery process. We have several more that we'll get through in the next couple days, and then we'll be moving more towards a kind of a recovery type of aspect. We do have tests pending. We still have tests coming in as to today, and so we're anticipating positives. So we'll be kind of still in that flux where we're going to have recovery units, we're going to have isolation units, we're going to have quarantine units, we're going to have positive units. So as you can tell and probably think about, the coordination of that is quite extensive.
Thanks, Warden Weiss. Pretty in-depth kind of look at some of the systems and processes we have in place. And I can tell folks the process at Clarinda is a little different than the process was at Anamosa, which was a little different than the process at North Central. And each prison has general guidelines they all follow, but they're all customized based on their population and the amount of viral spread that we're noticing at that prison. So I appreciate you kind of giving us a look at how Clarinda's looked. Director, I'd like to go back to you. You've been to both Clarinda and Anamosa here this last week. Could you kind of give us your assessment on both how staff and incarcerated men have been responding to the outbreaks at these and other prisons around the state that currently have positive cases?
Sure. Thanks, Cord. And as you know, as Cord mentioned, I'm here today at Clarinda. I'm here to meet with the leadership, the warden, his staff, and other staff that are working in the units, and actually meeting with individuals that are incarcerated that they're positive. I've done this before. I was in Anamosa on Tuesday, meet with Jeremy and his staff, and actually, walking around the facility, going into positive units, talking to people, these individuals that are positive through their cells and checking in on them. It's really important to get around. I've done, like I said, I've done this before. I think it's really critical to get on the ground, see what's happening, check in with staff. We know this is a marathon, not a sprint, and it's been around for a while. Asking staff, to stay the course during very challenging times. But what I will tell you, and what I've seen, not just in the past, but I've seen here at Clarinda and at Anamosa, is staff are really positive. They have great attitudes. They're here to get the job done. They're here to make sure that we have safe operations of our prisons. They're here to make sure that the individuals incarcerated remain safe and healthy. And that holds true for our medical staff. They're constantly keeping their eyes on these individuals. It's just absolutely incredible how positive staff has been and how long we've been in this. As many have heard the word COVID fatigue. And going into these prisons, these staff are just doing an amazing job. They're passionate, they're committed, they're working hard, they're committed to the mission of the Iowa Department of Corrections. I will tell you too, by talking to the individuals that are incarcerated, there are, on these restricted movements, and I was going cell to cell and talking to these individuals that are positive. Ask them, how are you doing? How are you feeling? Most of them were asymptomatic or had very mild symptoms. But the main thing that I really caught and learned from these discussions was these individuals were saying, we get it. We get why we have to be, restricted. We get why you guys are doing what we need to do. And we actually appreciate you and appreciate what you're doing to keep us healthy. So overall, there's a great understanding from those that are incarcerated that they know that we're trying to keep them safe. But it's been great to go around and talk with folks. Very proud of our staff. They're heroes. They are working long hours in tough conditions, and we really appreciate them, and we appreciate the individuals incarcerated that are being very patient right now.
Thanks, Director. Great insights from someone that's seen multiple prisons through their outbreaks. I'd like to jump back over to Anamosa and talk to Warden Larson. Could you, one of the questions we get a lot, I get from press and also from constituents, is kind of give us a better understanding of what a day looks like for somebody that is incarcerated during one of these restricted movement times when we're dealing with an outbreak. So kind of walk us through, is there a major difference between a day at Anamosa for someone that is positive for COVID versus those that aren't positive? Kind of what is that day like while we're under restricted movement?
Yeah, sure. Of course, Cord. Well, currently we are on restricted movement, as I kind of talked about before. But what that means, and let me back up a little bit just so you kind of get an understanding. When we initially had the outbreak, we went on restricted movement. That was no movement. For that first week until we could really test and find out who's positive, who's not. And of course, we communicate this to the incarcerated individuals. I send memos almost daily to their cells, letting them know, hey, this is what we're doing, this is what is going on, so that they know, and let them know that it was crucial that we didn't move at all because we didn't want anyone else to expose anyone else at that point. We knew, we were pretty confident at that point, once a few people were positive, we probably had some significant spreads because of our infrastructure and layout. So at that point, that's why there was no movement. But once we got through that first week, got all the test results back, and were able to move all of our positives from the negatives and kind of separate everybody in that way. And like Steve was saying, you got positive units, you got negative units, presumptive units were guys that you're not sure yet. They may be showing symptoms. We isolate all those and separated them. And then we were able to get some movement within the units, which means we were able to bring guys out for a half hour to 45 minutes at a time to shower, to get their kiosks, to get on the phone and call their families and do that kind of thing. So, and we're still on that schedule today of doing that in each of the units. Today, as we start to move some people, we may slow down movement a little bit today just so we can make some moves and separate our positive cases from our negative cases again. But then after that is done, then we'll start right back up with doing our showers and our phones and our kiosks. Now we do that in cohorts, which means we try to keep the groups smaller so they can get through and get what they need to get done, and so we're not cross-contaminating anyone else. And so that's kind of how we do that, and that's kind of similar, I think, around most of the other institutions how they've done that. And we find that works. Again, that's really trying to mitigate spread. But that's kind of what a day looks like here. So it is pretty restricted. And we know that it's not ideal for anyone. It's not ideal for staff. It's not ideal for the incarcerated individuals because staff are doing, all the meals, all the laundry, all the cleaning, and all of those things at this point. And to be honest, like the director said, when we go around and talk to the guys, they have been really positive and appreciative of what a staff are doing for them. We're checking on them, and we're doing rounds every minute. How you doing? I mean, this really is a medical emergency, and so we're checking to see how they're doing all the time. And they appreciate that, and they can't believe, man, you guys are doing our laundry, you're doing all the meals. Here at Anamosa, we have a lot of steps and stairs, and so it is a million trips up and down the stairs to all these galleys that we have where our incarcerated individuals live, and it's hauling meal after meal. So we deliver all 3 meals each day. We also, in addition to our meals, we do water, bottles of water and Gatorade several times a day. We know it's very important to keep these guys hydrated, especially the ones that are positive and going, trying to get through the virus and get over it and recover. It's crucial to keep hydrated. Everyone does have water in their cell. So they have access to foods 24/7. But in addition to that, we do the bottled water and Gatorade. We also deliver ice to the cells for the incarcerated individuals that want some ice. And again, we're doing laundry every day and trying to meet every single need that they have. Again, I cannot, like the director said, the staff is amazing that they've been working so hard, and we're short staffed because we're hit by the virus as well. And they're just doing more with less and really taking care of everybody and meeting their needs. And I couldn't be more proud of everybody, because in such a not a good situation, but to go around, like I said, the incarcerated individuals, when I talk to them, they get it, and they actually are thankful. For the most part, everybody has really been pretty positive. They know this is a long haul. We've told them from the beginning this is going to be a long haul, and they knew this. We've been talking about it for months. We didn't have any positive cases, but we've been talking about it with our incarcerated individual council. We kind of prepared for this. If we do get it, this is kind of what it's going to look like. And so guys weren't real surprised. They knew it had happened at other facilities. And so I think, again, the communication, the preparation has really helped us get through this in as positive a way as we can. Again, not an ideal situation, but so in the days to come, now that we're getting so many recovered guys, the days are going to start looking a little bit different. It's going to start looking a little bit different because we have recovered guys. Sorry about the phone call there, interruption. But we'll be able to start getting guys out and getting more active and getting some more yard time. We're going to be able to get guys out and start working, start helping out with, getting their jobs and getting back into a normal routine for a lot of those guys. So sorry about the interruption there. Now that's the way it's been every day you can imagine, for quite some time. It's very busy around here. So yeah, again, not to ramble, but I really just want to reassure everybody that all the guys' needs are being met. We are getting them out there. And even during the first week when we were completely no movement, we were printing off their mails. So we were delivering that to them so they could at least read the mails that were coming in from their loved ones and their friends. We provided an envelope so we could at least get a letter out to everyone, because we couldn't use the phones yet. And so we really tried to think of everything we could to make everybody's transition into this difficult situation as best it could be. And guys are really appreciative of those things as well. And like I said, now we're able to get everybody out and kind of moving around, and they're able to contact their families on their own, which I think has been very beneficial too. So that's kind of what our day looks like right now. Again, as we get people recovered, actually we're going to get a lot more movement and get some yard time for guys and things like that. So we know it's really important to get some fresh air and get out and moving around. But at the same time, can't move too fast, because we really want to make sure and mitigate any kind of potential spread. So we are gonna, it's just like the director said, it's a marathon and not a sprint, but just know that we are meeting the needs of everyone here.
Thanks, Warden. Maybe just jump to Clarinda real quick, kind of similar question. Beyond what Warden Larson has mentioned, is there anything, Warden Weiss, that you would mention that's different for a day of an incarcerated guy down at Clarinda?
Well, our prison certainly is laid out a little different than Anamosa's prison. So we are able to restrict our movement and move in cohorts a lot easier. Most of our units hold about 100 incarcerated individuals approximately, some less depending on what the incarcerated individuals, if it's a special needs unit or if it's a administrative segregation unit. But we're pretty much like that. Like Anamosa is, we pretty much restrict them to their units. We move them as units. We do a couple different things because we can, far as if you're a positive unit, we may release more at a time just because we don't have to worry about the spread, because most of our positive units are pretty full. If you're not in a positive unit, maybe you're on a presumptive unit or a positive presumptive unit, we may let less out and go a little bit longer with it, but it's very much similar to what Jeremy talked about. We just move in cohorts. We restrict that movement. We try not to contaminate or cross mitigate or anything like that, where we have people crossing paths. If we have incarcerated individuals that are assisting us, of course, they're previous positives. And so we utilize those to help us to run the prison, but it's very similar. They get out of their cells. They also have opportunity to shower. We do a little different here because we can use our exits a little differently, where we're not contaminating hallways in most of our So we're in most of our prison, so we don't have to sanitize. We're able to go out some of the exit doors where we can get them on the yard. So most of our incarcerated individuals get, even if you're positive or presumptive, we're able to get you on the yard just for a little bit, just to get some fresh air. And so, but very similar to Jeremy, we're pretty restricted, and we control it, and we control it as much as we can, just so we don't have spread. We just want to keep everybody safe, and not only the incarcerated individuals, we want to keep staff safe. And so that's why we try to really restrict that movement and control the movement, and utilize all the resources we have when we're doing that.
All right. Thanks, Warden Weiss. You made it pretty clear, kind of the men that are incarcerated are getting the things that they need between kind of the time out of their cells to use those facilities, getting the food and drinks that they need, and also kind of trying to get them out into the actual yard to get them some fresh air and some sunshine, which can do a lot during these challenging times. So I kind of just move on, and both of your facilities have received plenty of communication from constituents. I know we at Central Office have gotten plenty of constituents that have called in concerned, and our DOC hotline has gotten a lot of calls from constituents, people that have a loved one that's incarcerated. Just to kind of wrap things up for each of you, is there anything that you would like to say to those that have kind of been reaching out to you? You've heard the concerns. Maybe we'll start with you, Warden Weiss. What would you say to those that have a loved one incarcerated that maybe haven't reached out to you yet, but you've heard a lot of questions? What would you communicate to the public?
I think I want the public to know that we're doing everything we possibly can to keep everyone as safe as we can. And that's not only incarcerated individuals, that's staff, that's anybody that's coming inside of our correctional facility. Whether that's wearing PPEs, required PPEs, having incarcerated individuals wear the PPEs. We just want everybody safe. And that's why we plan so much. That's why we have to make modifications to our schedules. I just want people to know we're doing everything possible we can within the infrastructure of our facility to try to keep everybody safe as we can. Is it challenging? Yes. Are there tough decisions to be made? Yes. Also, I just want to know the public to know, we're trying, if we have positives, we're contacting emergency contacts right away. We're letting you know that your loved one has tested positive so they can spread that word amongst their family. We have counselors that are manning phones, so if we get phone calls, we're giving out the information that we can give out. I know sometimes people might get frustrated because maybe it's not everything they want to hear, but we're giving you everything we can. We're also doing daily communication with the incarcerated individuals. We send out daily information on how we're going to handle cells. We try to get the right information to the individuals and our incarcerated individuals. We also send out daily notices to our staff, so they have those. But I think the biggest thing is we're just kind of trying to apply the best practices that we've learned as we went through this and make those modifications as we go. Kind of some of the things I think the department, and I think Director Skinner and everybody else would agree, is the best way to handle these types of situations that we're having with outbreaks is testing and quarantine. I know it's not convenient for incarcerated individuals. It's not convenient for staff, and it's not convenient for family members. We've had to restrict visits. We've tried to do visits as much as we can, but there's to a point where we can't do that. And I know that's hard on family members, but through our testing and quarantine process, it becomes necessary so we don't have more spread. So just to wrap this up on my point, and I'll let Jeremy go, but I just want everybody to know we're doing everything we can. We're working day and night to try to do everything we possibly can to keep everybody safe.
Thanks, Warden Weiss. Warden Larson, anything that you would add to some of the points that Warden Weiss made on kind of what would you say to those that have a loved one incarcerated there at Anamosa?
Yeah, I appreciate Steve going first on that, since I could echo a lot of everything he just said. I just want all the friends and loved ones of those incarcerated here to know that we really, truly are doing everything we can. The staff have been amazing with the incarcerated individuals as far as checking on them. Our staff do rounds, continuous rounds, and we've told them over and over, check on everybody. Make sure that they're doing okay, ask them how they're doing, and if they're not, call medical. Our medical staff have done a phenomenal job in taking care of those individuals. They get there when they need to. It really has been all hands on deck and making sure that everybody is okay here. And just a shout out to the whole Department of Corrections team and medical staff from across the state. They've sent help to us when we need help. When we need extra staff here, we're getting extra staff here to really address all those medical concerns. And luckily, it's really a small group of incarcerated individuals that have had more severe of the symptoms, but we are addressing those needs. So I just want to assure everyone out there that no one's getting overlooked. We are taking care of these guys. We know it's a medical situation, and we are meeting their needs. As far as just their day-to-day needs, as I already talked about how the day goes throughout the day. So I cannot just reassure anyone that enough. We are checking on these guys all the time, and staff do care. There was an example the other day. The deputy director was here, and he was on one of the units, and he had just witnessed one of the officers doing a round and was asking one of the incarcerated individuals, "How you doing?" And that person was struggling a little bit, just saying they weren't feeling the best, and said, "Well, I'll get a doctor over here right away," and they did. And that is what it's really all about, is we're checking on these guys, and we are making sure that they're okay. And we tell incarcerated individuals and the staff, we truly are all in this together. Those of you in the community, you know what it's like in the community right now as well. We are all in this together, battling this pandemic. It's truly a risk everywhere, and I guess it is just what we have to deal with today, and we are going to take care of everyone and do the best we can. So we appreciate everybody's understanding, and just know your guys are in good hands with us. Thank you.
Thanks, Warden Larson. Very well put. So final thoughts. I'll go to Director Skinner. I know you're there at Clarinda. You mentioned you were on a positive unit just a little bit ago. I would point out that when you go on those units, you're in full PPE, mask, face shield. I've seen you in your gear. So I just point that out. You're being very safe while you're going on those units.
Yes.
Now, I would just ask you, Director, you've been on daily updates with the wardens at all the facilities that have positive cases. You've been to every prison that's had an outbreak to see for yourself how things are going. What would you kind of like to leave us with for final thoughts for this panel?
Well, I think it's important to know that, and it's been mentioned, and I echo everything the wardens just mentioned in their final comments. It's a very fluid situation. We are very on top of this in terms of our daily meetings with Incident Command, and we fold in public health and the experts when needed. And as everyone knows, it wasn't an if, it was a when. And we have been preparing for this since March. And we have staff and our leadership and our wardens, our medical staff, and our teams have done an excellent job in terms of getting us prepared for this moment, which we're in right now. I also want to say we're not an anomaly in terms of what we're seeing across the country. I talk with a lot of directors across the country. Numbers are on the rise for COVID positives for individuals incarcerated and staff. So what we're going through is really not a lot different than what we're seeing across the country. But I do want to tell you that we are working around the clock. Our Incident Command, our wardens, our staff are on top of this 24/7. We're consulting with the CDC guidelines, working with public health, working with our medical staff, using best practices when it comes to mitigating, containing COVID and keeping people healthy. We care about your loved ones, and we want to make sure they're safe as well as our staff is safe. And we're going to do everything necessary to keep them safe. But we also, at the same time, as I mentioned in my other director's video, want to encourage you when you do talk to your loved ones to wear their PPE, to wear their mask, to wear their face shield. Even if they're recovered, we want them to wear their mask and face shields, to use universal precautions, to wash their hands, to social distance, things like that. That can truly make a big difference in the spread of COVID in our prisons. Again, I want to really thank you all for your patience during this time. I know it's not been easy for you as family members and loved ones. I know it hasn't been easy for your loved ones that are incarcerated. As the wardens mentioned, we're doing everything we can to keep them comfortable and healthy, the best that we can. And I also want to say thank you to our wardens here on this call and court for facilitating this today. and your leadership, your exceptional leadership you have shown through this difficult time, and to all the wardens and the medical staff and staff across our state for Iowa Department of Corrections who have pitched in and jumped in and have been working really hard around the clock to keep not only staff safe, but your loved ones safe. So I just wanted to say thank you to all, and thank you to our family and friends for your patience during this time. Again, we are doing everything we can to keep your loved ones safe. So thank you.
Thanks, Director. And as we're, you listed a lot of those groups that we work with throughout this pandemic, and you're absolutely right. They're all been wonderful partners to us as a department. And one that I didn't hear you mention, I think I just want to get in there, is the hospitals around this state, especially University of Iowa hospitals and clinics, have been absolutely outstanding partners to us. When we need them, they've been there and really helped us and our incarcerated folks throughout this whole process. And with that, we thank everybody that joined us for this YouTube video update. And we'll be with you next week to give you another update. Thank you all very much. Be safe.